Testing for osteoporosis has improved quite a lot in the last few years. Most people have heard of a DEXA scan or bone densitometry. This is a useful test, but it does have some limitations. This presentation will overview new tests that are available for you now. As you will see, hormones, nutrition, strength, and balance are all involved in the genesis of osteoporosis. If you really want to have strong bones for the rest of your life, it makes good sense to test comprehensively. By leaving something out, a key ingredient to how you could be helped may be missed. For example, a hormone level, a nutrient problem, or a balance issue. Who should be tested? Any person 40 years or older or approaching menopause should be tested. In addition, if you already know you are osteopenic or have osteoporosis, you can use these tests to monitor the therapies you are using. Any person with a sedentary lifestyle should be tested. Any person who is a smoker should be tested. Any person taking long-term glucocorticoid therapy should be tested. And any person with rheumatoid arthritis or a connective tissue disease should also be tested. Bone densitometry. Until recently, testing for osteoporosis and osteopenia have relied solely on bone densitometry, also known as the bone density test, and also known as the DEXA scan. This is a useful test, but has some drawbacks. First, bone densitometry is usually done once per year and will tell you how your bones have fared since your last test. It cannot tell you if you are losing bone at the time you take the test. Thus, it cannot give you feedback as to whether any drugs, vitamins, and minerals you are taking are working to help you. Secondly, bone densitometry scores are based on comparison to a healthy 28-year-old adult woman. Based on this comparison, how many 50-year-old women would be expected to have normal bone mass? Not many. Lastly, and most importantly, bone densitometry cannot tell you the reason your bone mass is decreasing. And this is critical information because you want to be able to identify and correct the reason for your bone loss. The best plan is to combine bone densitometry with other tests. The reasons for bone loss vary from person to person and can be one or more of the following: reduced levels of some hormones, elevated levels of other hormones, lack of proper exercise, lack of proper nutrition. You see in this slide the bone health test. This is the most comprehensive method of evaluating your bones that is available today. As you can see, it includes bone densitometry, but many other tests as well. Here you see a combination of saliva tests, urine tests, blood tests, strength and balance tests, and bone densitometry. Why test hormones? You may not be interested in actually taking hormones because there is an increased risk of cancer and heart disease when you do so. So what is the purpose in testing for them then? Besides hormone replacement therapy, there are other reasons for testing hormones. By using diet, nutritional supplements, and other techniques, you can maximize and balance your hormone levels without actually taking the hormones themselves. Thorough hormone testing can guide these nutritional therapies. Here are a list of all the hormonal factors involved in osteopenia. Most people will be familiar with estrogen, or as it's listed here, 17-beta estradiol. We know that low levels of estrogen tend to cause decreased bone mass. In addition, however, low levels of progesterone, testosterone, calcitonin, and DHEA or DHEA sulfate also will cause bone loss. On the other hand, high levels of cortisol, parathyroid hormone, thyroid hormone, and follicle-stimulating hormone will also cause bone loss. Blood sugar is listed here because elevated or poorly controlled blood sugar affects other hormones adversely. Therefore, it is very important you keep your blood sugar under good control. When you test for hormones, it is most important to have the proper test to get an accurate result. Certain hormones are better tested with a sample of your saliva. The hormones listed here are best tested with salivary hormone testing. This will tell you the important free fraction form of these hormones. Testing these hormones in the blood would not be as accurate. On the other hand, blood hormone testing for the following hormones would be accurate: calcitonin, parathyroid hormone, thyroid hormone. Again, blood glucose or hemoglobin A1C, which are both measures of your blood sugar level, are listed here because blood sugar is very important as it affects the levels of other hormones. The DPD test is a very good complement to the standard bone densitometry test. The bone densitometry test has some drawbacks. It cannot tell you what is happening in your body at the time you take the test. It only tells you how you are doing since the last time you took the test. So, for example, if you took the test in June 2011 and then take it again in June 2012, it will tell you what has happened over the last year. When bone tissue is broken down, proteins appear intact in the urine. The DPD test provides an accurate measurement of whether or not you are losing bone at the time you take the test. Thus, it tells you whether your current regimen of exercise, supplements, diet, and drugs is working to prevent bone loss at the time you take the test. The DPD test is a urine test. The sample should be a first or second morning sample. Muscle strength is essential to healthy bones. Muscles pull on the bones they are attached to, and this is one of the main ways bones maintain their strength. The condition of having inadequate muscle strength is called sarcopenia, and it is an important condition to know about. It is important to have adequate muscle strength and coordination around all your bones and joints to prevent both osteoporosis and osteoarthritis. We test for sarcopenia with various exercise tests. Everyone at risk for osteopenia or osteoporosis should have these tests. As far as treatment of sarcopenia goes, walking, although it is helpful for your bones, is not as good as training with weights. Everyone should train with weights. They don't have to be really heavy, just heavy enough to make your muscles work. Since one of the main goals of osteoporosis treatment is to prevent falls, it should be obvious that balance testing and training should be done on everyone. Unfortunately, this is rarely what happens. Unless you complain of dizziness, vertigo, or extraordinarily poor balance, you will not get tested. Although assisted devices can help you prevent falls, people tend to lean on them at the expense of training their own balance. In addition to the inner ear, your feet, back, and neck contain nerve receptors important for balance. Clinical experience has shown us that with proper instruction, these areas can be strengthened and your balance can be improved. We test your balance with a variety of devices right here in our office. These tests are just as accurate as more expensive testing. Here is another look at the overall bone health test. If you really want to prevent or treat osteoporosis, you should know all the factors involved. This is the way to do that. We perform or order all these tests in our office. Should you have any questions about the bone health test, don't hesitate to ask us. We are here to help you.